Thank you so much.
Thank you so much.
हम जितनी भी स्वास्थ्य की सेवाएं हमारी गाड़ी के सब फ्री हो गए। जितनी बीमारी है हमारे पास 99% का इलाज है। सिर्फ एक वो कोई बहुत सीरियस होता है उसको नीचे भेजेंगे, वरना कोई जरूरत नहीं होगी, हमारी गाड़ी का इलाज है। और तो पैसा भी नहीं अभी हफ्ते में 2 दिन हम करेंगे, क्योंकि जैसे फ्राइडे आते हैं दवाई हम 3 दिन की देंगे, तब हम फिर दोबारा देखेंगे कैसा है। तो इस तरह से हमारा सिस्टम चलेगा। फिर धीरे धीरे करके हम और ज्यादा फ्रीक्वेंटली आने लग जाएंगे, और जो बस्ती के लोग को पानी और आप तो पहले से ही करते हैं। और मैंने 100 छुट्टियों में मैंने अभी तक काम कर चुकी हूँ। मैं इनको कि 101 नंबर, 102 नंबर, 103 नंबर अब आज जुड़ गया। यहाँ 3 बच्चे हैं। जी। तो आप यहाँ कब से कब से? अरे वाह, क्या हमें ताली तो बजाओ, ये बात तो बहुत बड़ी चीज है।
तो थैंक्स बोलिए मेरी तरफ से, हमारे सब लोगों की तरफ से।
Absolutely, sir.
हमारे लिए कुछ किया।
Bilkul, sir.
Lady, can you tell them?
Yes, expressing his full-hearted thanks for all the help that you are given for the community, and he's really grateful for it.
So आइए, और Jim has a pair of scissors as well.
Jim has a scissor.
Can we have his scissors also?
Yes.
ये ना इन्होंने एक नकली कैंची अपने साथ उधर मतलब असली कैंची है, लेकिन हमने बोला आपका नाम भी होना चाहिए इस उद्घाटन में। आज प्रधान हो आप साथ, आप आ जाइए, आप ही आ जाइए साथ में, इधर आ जाइए। आप मेरे साथ प्लीज आप ready?
Karen, would you like me to say something?
Yes.
1, 2, 3.
Congratulations to Asha on their mobile health van.
That's wonderful.
And you may well cut the ribbon where you are at the moment, but I'm going to cut the ribbon here. Congratulations, and thank you to our partners in America who have helped fund this, to Luann and to Mandy, who's here, and David, all the people who've been involved. This is a huge achievement.
Yes. Yay.
Okay, this is the registration counter. The patients are going to come sit here, their vitals will be taken, their cards will be made, and then so this is where the doctor is going to sit, aka me. And sometimes Rama, because Rama is our doctor as well. She's a senior nurse practitioner, so she's the one who sits there. And as you can see, the pulse oxy is here, the blood pressure apparatus is here. Everything is gonna be done over here, and we have a stool here for the patient. And then this is where the medicines will be, but they will all be dispensed from outside because there's no room in the van. And by the way, this is well air conditioned, so it's really cool and nice inside. So here's where the drugs are going to be dispensed. Okay, here you can see on this side is the key of the van. So every possible drug that you can imagine that are used for 99% of ailments are available in this pharmacy. And they're all going to be provided free of cost. There's going to be no money taken from any patient who comes here.
Fantastic occasion, brilliant achievement. The van looks marvellous. We are absolutely privileged to have been one of the donors in Australia. I have to credit my friends and colleagues, Richard Leader and Rob Johansson, Carolyn Chernoff, who all helped do this. This goes back to 2023. I have some very trivial questions, Kiran, which are going to sound awfully personal. And how many people would travel in the van?
Yeah, I'm just going to tell you basically, there are 3 slums
Yes.
one next to the other. And there's a population of about 5 to 6,000. We haven't yet done a count, but I remember 5,000 के आसपास से लोग तो होंगे.
5,000.
5,000. Yeah, the MLA knows not much more than I do because he's a third time elected MLA from here. So they obviously all love him and he's very popular. So he says about 5,000 people live in this area. And they have all kinds of jobs they do. You know, some of them play drums. There are others who are rag pickers. And then there are some who work in the industrial area close by. So there's a lot of poverty in the area. And when Shiv goes and shows you the houses, you'll see that they're mostly made of, plastic sheeting. The roof is not made properly and even the houses are, not in good shape. So yes, there is a great deal of poverty. They don't earn more than 200 to 300 rupees a day. Those are things that is the maximum, he'll say. आपको इस एरिया के बारे में आप कुछ बताना चाहते हैं लोगों? मैं तो कम जाती हूँ, आपको ज्यादा हमारे पर.
मैक्सिमम पीपल बिलो पॉवर्टी लाइन के रहने वाले यहाँ पर है और डेली और सबसे बड़ी बात यह है कि इलिटरेट है, शिक्षित नहीं है. तो इस कारण से क्या करना क्या नहीं करना और हेल्थ के प्रति कॉन्शियस नहीं है. हेल्थ के लिए अगर कोई छोटी सी बीमारी है तो उसको भी अफोर्ड नहीं कर सकते. पेइंग कैपेसिटी बिल्कुल ना है. तो यहाँ पर ये आप लोगों ने जो किया है इस एम्बुलेंस, ये एम्बुलेंस जो है यहाँ के लिए एक प्रकार का वरदान साबित हो.
He's saying that the people are all below poverty line living here and also that they are completely illiterate and they do not understand how healthcare should be accessed and they do not even understand when they should go for healthcare. So they end up going to places where they can't afford. Basically, all the places around here are not affordable for them. So he is saying that this van is a big gift for the community that is living over here. This is Ishwar Singh. He is the head of the police station of the whole area. Mansarovar. This area is called Mansarovar Park. So he is the station house officer, which is abbreviated as SHO, and he is the head of the police station of Mansarovar Park. So I'm sure we can work together. ये लोग सब हमारे donors भी हैं, दोस्त भी हैं, बहुत पुरानी relationships हैं हमारी. तो प्रोफेसर जिम जो है वो मेलबर्न यूनिवर्सिटी में बहुत सीनियर प्रोफेसर है ऑस्ट्रेलिया में. उन्होंने वहां से ज्वाइन किया है. ये मैडम मैंडी है, इन्होंने न्यूयॉर्क से ज्वाइन किया है. बहुत सारे लोग हैं जूम कॉल पे, लेकिन हम लोगों ने सिर्फ 2 जनों को चूज किया है कि बात करने के लिए, क्योंकि सारे लोगों के साथ बात करना. तो we are very glad that Ishwar Singh is also here because we can work together, especially with matters that are related to where we require the cooperation of the police. That is, something is impossible not to have. So, Mandy, can you please share a few words with us?
Yes, I appreciate being invited here and just seeing the van come to life is pretty amazing. The ability to provide healthcare for 5,000 people who otherwise aren't able is life-changing. And so I bless the van, I bless everybody who's been a part of it, and just pray that it brings abundance and health and just a stronger community.
Thank you so much, Mandy. Thank you so much for the word. May I request the MLA first and followed by the SHO to say whatever remarks you want to make.
Thanks for this kindness. All pupils are very happy and all medical facility given by you, they highly oblige and I and SHO दोनों हम आप लोगों को thanks बोलते हैं इसके लिए.
Just saying, both the SHO and me are just thanking you a lot for helping with.
Thank you so much for giving such an excellent services to this cluster over here. These people who are residing here are we can say deprived of the health related services. So this is excellent and noble job and services which you are rendering to all these people. Thank you so much. Please take my personal gratitude for it. Thank you. Thank you so much.
Thank you very much.
So happy to hear from these two. So there are three interconnected slums. They're showing them to you. And you can see clearly that the
Yes.
material of which the shanties are made is all temporary and discarded. And
Yeah.
you've seen many of the Asha communities. Like this is like much, much worse than the ones that you've seen. Like in none of the Asha communities do we have tarpaulin sheets or
Right.
asbestos sheets sort of making up the walls. And the slum is sandwiched between the railway line on one side and a heavily trafficked flyover on the other side. So this is under the flyover. And one of the reasons why we chose this is because there's a place for this van to be parked. And
Okay.
without parking,
Yeah.
it's impossible. And civic infrastructure is obviously the MLA has provided whatever he could. But there will be some more work, and we can always do that work together. The toilet complexes are also, there's one mobile toilet, and then there's another toilet which is public. A lot of people, of course, go out into the open because of the conditions in which they are. They're all employed in small factories. They're employed in scavenging, shoe polishing, and they also make flower garlands. They're given the flowers and they make the garlands, and then the garlands are picked up from here. So they obviously
Okay.
hardly get paid for doing all the main work of making the garland. And there is an industrial area here, and they work in that industrial area. And there is a problem with water, and I'm sure that Jitendra ji and I, we can always work together to increase the water, the open drain and. अच्छा यहाँ पर अरे वाह क्या बात सारा रोड बना रहे हैं अच्छा पूरा रोड आप बनवा रहे हैं
रोड और ड्रेन सारे
He's saying that there's already a plan in place to construct this road properly and to construct proper drains. Like you can see over here, the drains
Yes.
are not properly constructed. They're just man-made. So he's already got a plan in place.
सेक्शन हो गए
He says that the sanction has already been obtained and the
Okay.
work will start shortly. Did you want to ask
Right.
anything? इनको कुछ खिलाया नहीं? करने नहीं? आप ये लगे ना?
मैं किसी नहीं हूँ आपने एकदम रिपोर्ट नंबर डाल दिया पूरा
ठीक है.
मैं आपको
He's going to leave, so I'm just saying goodbye to him, and then we're going to be. I'll literally be back. After you go, okay.
थैंक यू सर थैंक यू मैम
Thank you.
Thank you so much, Jitendra
Thank
ji,
you
for
very
coming.
much.
से जल्दी
Yep.
मिलेंगे. Yeah, so I didn't really want to show him in a bad light because he's a local MLA. And he's the third time elected MLA. I really don't know because you can see how terrible the conditions
Right.
are.
Right.
And I just didn't want to expose him. So I didn't
Yeah.
really,
You did a wonderful job.
I wasn't really that blunt. But
You need
the
to be
fact of the matter is that
diplomatic.
there are no water points. The toilets are completely blocked, and so nobody uses them. They just go and defecate out in the open. And the level of poverty is much greater than that in many of the Asha communities, which have risen out of poverty.
Right.
Because of the years of work. So it's a bit like starting from scratch, the way I
Yes.
did back then.
Completely.
It's going to be so much. Just have a look at this. Look at the,
Yeah.
there's dirty water everywhere. There's garbage everywhere. There's no facility for garbage disposal. People use cycle rickshaws, that's another profession. And here, look at this. I think they're just sitting right in the middle of the garbage. Just imagine. She's putting her hand inside.
Yeah.
I don't know to do what, but she's put her hand right inside, and there'll be a lot of malnourished kids. These are the toilet blocks that I was talking about, but then they're
Okay.
completely jammed with excrement, so nobody ever goes in. And this guy should have done a lot of work, but obviously he
Yeah.
hasn't. I don't know how they keep electing. The whole story is the same, like I've said before. They get elected because the pradhans are the ones who take them to the polling booths and force them to elect this person. Okay, now he's showing you the inside. Oh my God.
Yeah.
But bikes around, I don't know.
Yeah, there are.
There may be some people who have the capacity to afford a bike, but You've seen the Asha communities many times. This is like even Selampur is really terrible, but I've never seen something that bad.
Right.
So I think now's the time for any of you to ask any questions or make any comments before we go off the Zoom call.
Kiran,
Please feel free.
thank
David,
you.
Luan, whoever's there,
I guess I'm interested, Kieran, in how you identify or how will people come to the van, or how do you identify the health problems that need to be addressed? Or, in other words, how do you get patients to the van and identify the people who need care?
That's a very good question. So basically, we have a team that is made up of a nurse practitioner who is like a primary care doctor. I mean, she really does know everything. And then we have paramedics and community organizers and social workers. So it'll be a mix of those who have already been with Asha for a long time and some new ones, because we want to make sure that the really well-trained ones train the ones that are new. So there'll be a whole team that will come out, and even community health volunteers from another slum will be coming, as will Asha ambassadors. So they're all going to fan out to the entire community, all three communities. As soon as the van arrives, they'll get off the van, they'll tell everybody, that there's this van and you'll be getting free medicines, if you're sick. And not only that, but there may be certain people who are sick, but who really don't know what to do with their sickness, so they will be able to make sure that such patients also come. And there is a place here for about maybe 4-5 patients can wait here. And then see, this thing gets converted into an examination table.
Okay.
When you're bringing the van from our headquarters, it's obviously a seating area for the staff. But when it reaches here, then it becomes converted into an examination. दिखाई दे रहा है तो नहीं, ये बहुत ऊपर हो गया, नीचे करके देखना पड़ेगा. Yeah, so now you can see that that's actually an examination table.
Yeah.
And you see, yeah, curtain डालो, curtain डाल के देखो.
Yeah.
Yes. Yeah.
Yes, well done.
Yeah, so the seating area gets converted into an examination
That's
table with a private curtain for privacy. And there's area here for about 3 to 4 patients. And the rest, of course, will have to wait outside. But then they're used to it, they're used to the heat. दिखाई दे रहा है ना? And so my hope is that because of the team we have and everyone's going to every household, we'll be able to get all the patients. I also suspect that the moment everyone understands and realizes that there's this van and it's going to come, there'll be no need to go anywhere because all the patients will already be
I think so. Yeah, I think so.
That's what I think will happen.
Yeah.
Yeah, I think so.
Right.
Thank you. Yeah, thank you.
It's amazing, Karen.
Yeah. it is
Amazing, Mandy. I should say
It's
amazing, Jim.
amazing.
Amazing, Mandy. You're the one who first started off the whole thing, Jim.
Exactly.
Because if you
Well
recall,
done.
we were celebrating our 35th, and David, you were there that day. And if you remember, Richard came in and he made an announcement, because that's the time when I spoke about my desire. And he made an announcement right then and there that Australia was going to pay for this van. And then, of course, the journey began with Australia. And then I started talking to Luan and Mandy and Jean. And then Mandy was amazing. I don't know what the magic was in the appeal she wrote. We had lots and lots of people make contributions, not least, of course, those of you who are on the call. And so we then got the money, to do all this work. And can you call Freddie here? He has really been the main person who has done all the work. Because it takes a lot to buy a van that is appropriate, then to get it fitted out, and then to get it properly registered with the authority.
And it was done very quickly.
Yeah, he's
Freddie.
Hey,
Hi,
Freddie.
Freddie.
a big round of applause.
Freddie.
Hello,
Thank you,
hello. Congratulations.
I couldn't have done it without you guys. Without you guys, I couldn't have done it.
Tell
Well,
me
we
your
certainly wouldn't have done it without you, Freddie.
Challenges
Yeah,
was getting the
exactly.
vehicle. Challenges was in registration of the vehicle.
Okay.
Challenges was not to give any money under the table to anyone. That was the biggest challenge. And this time we decided we are not going to grease anyone. No, we'll wait. And we waited for 6 months, but we got it.
That's
Well done.
amazing.
Biggest challenge.
It's really
In this
amazing.
Well
country,
done.
everybody wants,
Right.
Not about cheese.
they call it here service charges.
Oh, okay. It's wonderful. It's so good to see.
Well done, you. Yeah.
Yeah.
And the best part is the vehicle is so cool inside. So cool.
Yes.
It's beautiful.
We are distributing laddus, you know, the Indian spherical sweet. We are distributing it to the whole, to lots of community members who are gathered around
That's
the van
wonderful.
outside.
Yeah.
When you distribute spherical sweets, the laddus, it's just like when you're celebrating something or something
Right.
nice has happened. So we've got hundreds of laddus that are being celebrated, distributed outside to the community members. Ah, they're showing you the laddus
Yeah.
also.
Yeah, it's perfect.
Oh,
That's
it's
so
great.
good.
Duane, do you want to make any remarks or say anything?
No, I just think it's wonderful. I think it's inspiring. I think it's great
Yeah.
for us to see just what can happen, and we just wish everybody very, very best for it. It's just a breath of fresh air
It is.
in a world that doesn't feel very good. So it's great what can be done.
I mean,
Excellent.
Jim, you know, Luan is the treasurer of the Australian Friends of Asha organization, and she pours her heart and soul into
Oh my
the
gosh,
work.
so much.
And you know, while of course, you know, all the different board members put in their efforts just like you do, she's the one who has to make sure that all the finances are in good order and that they reach Asha in good order. So she and Freddie work together on the financial side of things. You know, all the money that's come in, she's had to handle all that. So that's also a really big piece of work.
Yes.
Well done, Luann, and to you.
Yeah.
And Jim, just all of you know, I think Jim and David, I mean, just having two of you here, Jim is a very senior person at the University of Melbourne. He was the pro vice chancellor. And before, I don't know, he's held so many posts that I can't remember now because he's basically part of the University of Melbourne furniture. And he is a very senior microbiologist by profession. And Jim David here is, he was the dean of Harvard Divinity School for about 12 years. And he just stepped down a few months back. And now he continues as a tenured professor at Harvard, teaching students and doing lots of other projects because they just refuse to let go of him. So, do you, Jim, do you want to just quickly tell everyone a little bit about yourself? Because I'm sure I haven't done, I've said very little.
Well, thank you. I think in such distinguished company, it feels uncomfortable, but I was Deputy Vice Chancellor in charge of research at the University of Melbourne and got involved with Asha through the Australian organisation that was initially sponsored by Alex Chernoff, the governor of the state. That's how the kind of lofty orbit that Kiran Martin orbits in when she's in Australia. It's generally prime ministers, governors, and senior academics and senior business leaders, and so it should be. And I just think it's fantastic what you've done, and I think that, you know, having a mobile health van is a big signal, and it will be, in its own way, an advertising campaign for what you do. It will alert people to, you know, what can happen when people decide they're going to change things and try and make a difference to the lives of people who, you know, struggling every day. Every day is a challenge. So well done, you. Fantastic effort. Very proud to have been a part of this, and great to meet David and Luann and Mandy. I'm just,
Yes.
you know, what a wonderful case.
I think that's the one other great joy of this, Kieran, that it links all parts of the world
Exactly, exactly.
together.
Yeah.
It's
Yes,
that's
it
wonderful.
really does. Yeah,
It's amazing.
it's just wonderful. David, would you like to say, tell everyone a little bit about yourself?
Kieran, can I just butt in? If I go, it's because I'm getting the children to school at the moment and I need to get them breakfast. I'm not going to.
Well, thank you, Luann, for joining. But after David shares a little bit, perhaps we can call off. But I just thought it'd be
Okay,
nice.
I'll listen to David in case he thinks I'm ignoring him.
Well, just what I most want to say is what a blessing this is to all of us to be part of this amazing work and to see these, very challenging living circumstances for these wonderful people, and just to be able to supply some basic medical help in their lives is very, very special. From my side, I just want to, say just very briefly that, the Harvard Divinity School, which I'm affiliated with, is the most multi-religious divinity school in the world. We've got people from all the main religious traditions, and almost all of them are dedicated to some life of service or ministry or education in their lives. So that's also a special thing. So I think, in the midst of so many bad news stories in our world, including, the very disturbing recent events between India and Pakistan, and in other parts of the world as well, just, these little circles of goodness and compassion are really, really important. Even though in the great scheme of things, there's difficult things going on out there, at least within our circles, we can, just live in a way that's compassionate and caring for all people, including people in these very difficult circumstances. So thank you for having us as part of this great international family of Asha.
Thank you so much, David. Hey, I can see your lovely granddaughter on the screen.
Yes.
Is that Emma?
This is Emma. Hello, Emma.
David and Luann's lovely granddaughter. Is she wearing a Christmas hat?
No, she's a what are you, cheetah?
It's a snow leopard.
Oh, sorry, it's a snow leopard. Sorry.
Snow
She's a
leopard.
snow leopard. Oh, okay. Well, I'll say goodbye unless someone else would like to say something. Just by thanking all of you.
This is
Congratulations,
wonderful.
Kieran and Freddie.
Thank you for including us.
It's wonderful.
Yeah,
Kieran.
good to see both of you.
Well, it's such a privilege.
Thanks,
to have
Freddie.
you as our friends.
Blessings to all of you.
Bye-bye, everybody.
Bye, Freddie.
Bye.
Bye, Kieran.
Bye.